episode of the Alter Your Health podcast, your source of information and inspiration to promote the holistic transformation of your health and the health of our planet. I'm your host, Dr. Benjamin Alter. Today's conversation was a good one. I really enjoyed connecting with Dr. Gonzalez, a new friend and a fellow naturopathic doctor. Dr. Gonzalez completed a 2-year residency position at the Cancer Treatment Center of America in Philadelphia, Pennsylvania, where he supported hundreds of people in their healing of cancer using integrative medicine with a naturopathic and conventional blend. We talk about that today in our conversation. Dr. Gonzalez is now continuing to support people in their healing process from cancer and other sorts of diseases as well in his private practice in Los Angeles. Dr. Gonzalez is very educated and enthusiastic about environmental medicine, which we talk about as being one of the huge root causes of cancer. And I would go as far as saying a lot of other chronic health conditions. So that was kind of the focus of our conversation today. Environmental medicine, easy ways to, or easy or maybe not so easy ways of cleaning up our external environment in our homes and also the internal environment of the body, of course. We talk about some of these hidden chemicals that make their way into cosmetics and household cleaning supplies, the water that we're drinking, the air that we're breathing. We can't really escape it, and it's really no use trying too much, especially, of course, if it's gonna stress you out. But there are some very practical steps that can be taken to clean up the environment. And the byproduct of that is better health of your body, better health of everybody's body, and better health of our planet. And that's what this is all about. So I really enjoyed this conversation with Dr. Gonzalez, and I look forward to, maybe having him back on the podcast someday. Would love to know what you think about it. So remember, subscribe, rate, review this podcast after, of course, you listen to it. So without further ado, I just encourage you to sit back, relax, maybe make yourself a nice cup of detoxifying tea, and enjoy this conversation with Dr. Christian Gonzalez. Christian, Dr. Gonzalez, welcome to the Alter Your Health podcast.
Yeah, thanks for having me. What a pleasure.
Yeah, no, it feels, we were just talking about, we connected on social media, which is, it's like, it sounds kind of funny on one end, but it's like, wait, that's what social media is for. And it feels like you actually use it as such. And it was so refreshing to be like, feel like, I finally struck an authentic connection with somebody, in my world, in my field. And it's like, that's what it's there for. So thanks for using it.
Yeah, for sure. God forbid social media is not for like watching dog and cat videos, right? You can like have a real authentic connection with people and be like, whoa, this is what social media, the power of it, right? The other side of it.
The other side, the light side. Yeah, I think
the light side, yes.
The light side. Cool. Well, thanks for making the time, and I'm really excited to dive in here. So I'd love to give you a little time and space to kind of share a brief snippet of your story and how you came into naturopathic medicine, and then specifically how you came to focus within, naturopathic medicine being so broad, how you came to kind of be focused on what it is that you love and are passionate about these days.
Yeah. So, naturopathic, what a wonderful field for us to be in. I firmly believe in the power of what our medicine can do. And initially I started off wanting to go into healthcare of some sort. I ended up at dental school. I did a few years of that. And a loved one was diagnosed with cancer. That sort of switched things around. The cards shuffled very differently once that happened. And I was able to be exposed to what is the conventional approach to cancer, which does a wonderful job at treating the symptoms at that very moment, especially if they're emergent. But I was so put off by the lack of knowledge from, at the time, I didn't understand why the oncologist didn't know much about nutrition. Now I understand the training wasn't there. But more surprisingly, the dietitian was giving recommendations, which I knew at the time I didn't have nutrition training, but I knew from, just working out and learning about, fitness nutrition doesn't sound right. So jumping into the research, I found out more about how to approach it. And then naturopathic medicine unfolded in front of me with the most beautiful synchronicity at the same time. And I was like, what is this medicine? I was pulled into it. My intuition drew me there, and then I pursued that instead. And what an incredible journey it's been, because it's pulled me into a field. I mean, I don't just do cancer, but I would have never done cancer. I would have found it too hard, or just too many bumps in the road. But through that whole process, it was sort of like a life unfolding, a destiny sort of, for lack of better terms. And it's been a pretty crazy road, but it's an awesome one too.
Awesome. Yeah. So I know you did a 2-year residency at the Cancer Treatment Center for America in Philadelphia. So can you tell me a little bit about what that was like, what your days were like, what you were seeing, what you were doing?
Yeah, that was a great residency. I was blessed. Every time I woke up, I was like, whoa, I'm in this residency. This is pretty cool. That residency involved working as a team. It was an integrative oncology residency. So you work with the oncologist, radiation oncologist, surgery, and then the dietitians and all of the other disciplines, right? To maximize patient health and well-being. So what I found is that patients who took all of the disciplines as a whole did much better compared to those who declined, let's say, nutrition, but took naturopathic, but declined naturopathic and took nutrition. Or the ones who did nothing and just went in like any other conventional hospital and just did chemo, radiation, and went home. Those patients tended to do the worst. Just with symptoms. We're not talking about recurrence of cancer, and just educating themselves on what to do. So what an incredible residency that was, because I was able to see many, many cancer patients and see the power of what our medicine does to help people.
Yeah, no, that sounds awesome. When I was in school, I was doing some interning with a cancer doc, a cancer naturopath who, did a lot of adjunctive work. And I was absolutely blown away at the level of vibrancy that these patients had. And they would come in telling these stories. Oh yeah, I was just at they were kind of doing the adjunctive thing. They were getting their chemo as well. But one of them, I remember, I'll never forget, this woman was like, oh yeah, I was at the chemo center getting my infusions. And I walked in and the nurse is like, who are you here to visit? There's no way that you are a cancer patient.
Yeah, I've seen that. Yeah.
And it's like, I knew that on some level, but having that connection with the vitality throughout the healing process was really impactful for me. So it sounds like you were exposed to that, and that has really kind of shaped you.
Yeah, for sure. And I've seen that many times, and I'm like, I'm in the elevator with someone. I was like, I don't know if you're a cancer patient or if you're a caregiver here.
Yeah.
And then I'll see him in the clinic in the cancer treatment room, and I was like, that's the patient I saw in the elevator, and they look, more robust than even me, or anyone else in that hospital. Like, I'm like, you're vibrant, you're strong, you're glowing, mentally there, emotionally there, physically there. It's pretty incredible to see that a lot.
Yeah. So you mentioned some of the I think you used the word disciplines in the CTCA program, and you referred to naturopathic medicine and nutrition. What are these other kind of disciplines that some of the patients were, educated on or had the opportunity to engage with?
Yeah, acupuncture.
Okay.
What a great discipline that was for many, many reasons, even more than I thought, right? I was like, oh, you guys can handle the pain, but it went way deeper than that. So we had excellent acupuncturists on hand there. We had physical therapy, which is really important for the patients recovering or the ones who have severe neuropathies, the numbness and the tingling in the hands or feet. They will be able to do much better. So, and even emotional care, whether it's even pastoral care, if they were religious, or energy. We had energy healing there, Reiki and whatnot. So as a whole, there's some people who went in there and go, check me off the list. I got a full day. I got 11, 11:15, 11:30, and they were just moving all over the hospital. But, they saw the power of what taking it all in did.
Right? Yeah. And it sounds like all of those things have kind of empowered the patient to be much more active throughout the process rather than kind of just sitting back literally and receiving the treatment. They were an active participant.
Yeah, that's the paradigm that we work in
Yeah.
cancer care right now. Is you go into the clinic or you go into the hospital and you get your infusion and you go home and you suffer with the symptoms, you know, and you're a mess because I've never seen something kick someone's butt the way that chemotherapy does. I mean, that stuff is crazy.
Yeah.
So being in that state for so long and then finally recovering and then going, oh, my next infusion is in a few days.
Yeah.
That's you're just in this crazy cycle.
Yeah. Yeah. So could you tell us a little bit more about, like, I don't want to, like, put you up against the wall and kind of drill you with, your opinions and belief systems about like chemo, conventional versus alternative, but
you ask me any question, man, whatever. I'm here to say whatever. And,
cool. Yeah. So I'd love to know what your thoughts are. Is there a time and place for chemo?
Yeah, for sure.
And tell us about where that might be and when that might be. Yeah.
Yeah. So, it's a dangerous line to walk, especially as alternative healthcare practitioners, to completely dismiss conventional therapies, right? Because I do believe that there's a place for conventional therapies. It doesn't even have to be chemo. It can be something like a statin, maybe. So, but what I'm trying to say is that when there is a place, like in an acute situation, right? If someone has a super aggressive cancer growing, it's metastasized to their bones, to their lungs, it was on their breast, and it's impinging on a vital function, and you need emergent therapy, then I think there's an excellent place for that. I think that for patients who have a low-grade cancer, they should explore what the possibilities are as a whole, for not only chemotherapy or radiation or whatever it may be, but seeing what other therapies are out there. Now, there are different doctors practicing throughout the country who do various, they take various different avenues to what conventional therapy is, but they do their own thing, which is, to me, a lot safer, and many times a lot more efficacious, right? People have better results. But I don't want to dance the fine line too much. I'm not against it, but if I was diagnosed with a cancer, knock on wood, I would explore many, many options before I made a decision like that, unless it was an emergency one.
Yeah, for sure. I'm with you. Yeah, I mean, it feels so challenging and, impossible really to consider the scenario of, what would, but doc, what would you do? What would you do if it was your mother? What would you do if it was yourself? What, and, because it's impossible to answer that question. But at the same time, I am a strong believer that any sort of healthcare provider, one of their ultimate responsibilities is educating the patient what's going on in the body, what all of the options are, and allowing the patient to be, like we were talking about before, be an active participant rather than being told what to do.
Yeah. And I always tell people, you see, when you go and say you have, I have a lump on my breast, you get scanned, you get a biopsy. Next thing you know, a week later, you have a surgery scheduled. 2 weeks later, you have your first chemotherapy regimen. I mean, you really go right through it before you have the chance to take a step back and learn about, sort of have a full consent, right? They give you these papers and they go, here are your symptoms, but they don't know that one of the side effects to this therapy may be another cancer down the road. So I think people, and I'm not saying, I think people need to be more informed before they make decisions, rather than being like, this is my only decision. I got to go. I got to do this. I got to do this.
For sure. 100%. And it's really, it's really ironic because as all doctors are trained to do informed consent and give a proper PAR-Q plan, our alternative risk consequences, questions, and when I tell patients that, I'm like, oh, did your doctor talk about some of the alternatives or some of the risks of this procedure, this drug? And they're like, no. And I'm like, that it's just like, it blows my mind each time I hear that. Here we are trying our best to do no harm, but really not really.
Yeah. Yep. And
embrace
it
that.
happens a lot. And they give them
Yeah.
a giant, like, up-to-date printout of, what the side effects are, but nobody reads that. There's so
Yeah.
that's under papers for signing off for consent. That's under papers for your next schedule. And I think someone needs to sit down and go, hey, you need to make an informed decision. And here is what's in front of you.
Yeah. So is that, in coming back to like what you're doing today in our, in your life now, are you having those conversations with patients and kind of guiding them in making decisions in their treatment programs? And
Yeah. So I still work integratively with
yeah.
the whole team, but a lot of patients come in and go, I don't even understand what my cancer is. I don't even understand how aggressive it is. I don't understand what this stage means. Sometimes I'm shocked that there's a huge disconnect between what the reality of what's going on and what they think is going on.
Yeah.
And I think people need to be informed enough so they go, okay, now I understand. Some people want to be in the dark, and I understand that. Okay, let your doctors worry about things. But more people than not want to be like, I want to know what's in front of me, what's going on. I don't think there's good explanation for that.
For sure. So I'd love to kind of maybe pivot and shift a little bit, but with the question, like, what ultimately, cancer is an epidemic, obviously. I think we're all familiar with the fact that cancer rates are rising kind of dramatically in our world. And what do you think is the ultimate factor? What are the factors that are behind this? I mean, can we pinpoint them and really point our fingers, or?
What a great question.
Yeah.
And I get that a lot. By the time we're our parents' age, it'll be 1 in 2 men and 1 in 50. I mean, 1 in 3 women. That's crazy.
Yeah.
That's crazy. That's literally like, if you have 3 brothers, there's a good amount of you going to be 1 or 2. So, which is crazy. How can it be? How can that be okay? We are not necessarily more stressed than we were 20 years ago. People were stressed. People have life stresses, marriage stress, work stress. So let's look at the variables that change, right? Our food supply and the adulteration of our food has changed dramatically, especially since the 70s. Dramatically. And we're exposed to a lot more harmful agents in our food than we were many years ago. I mean, if you think about your grandfather, they ate a bag of broccoli that was full of nutrients. The soil was strong. It wasn't depleted. And, it takes about 10, 11 bags of broccoli for us to even equate that one that our grandfather was eating. Mm-hmm. All right. That's one thing. What about genetics? All right. So genetics have ran in families, but we know about epigenetics, right? What the things in our environment that turn on and off on our genes, and particularly these cancer genes, right? If your mom has breast cancer, that doesn't mean you're going to have breast cancer. It does mean that you need to be very careful about what your lifestyle is. So the other part of it is I do believe that there's a major role of environmental toxins in what our exposures are daily that is contributing to the rise in cancer. Environmental toxins, including the things we put on our face, the things we put on our skin and our hair, the things that we're consuming in food, the stuff that's in our water. As a whole, I do believe it's having an additive effect in increasing cancer rates.
Mm-hmm. Yeah. So come back to the genetics and epigenetics. So just to clarify here, so you're saying that our genetics are not changing, and so we can't really point our finger at the genes?
I think that more to blame at our genetic expression of cancer are the factors that I was talking about.
The toxins that might turn on the epigenetics.
Yes, or the lack of nutrition, right? Remember, I was just saying about the broccoli. Like, I think those are 2 major things that we're overlooking. And it's not the oncologist's job. It's not anyone in the hospital's job to sit down and go, let's check out what are you washing your hair with? What are you putting on your skin every day?
For sure.
Because they don't have the time for that. Their only concern is to get that stuff out and kill what's there now.
Totally.
But it's our job. So hence why that's only 50% of cancer treatment, getting chemotherapy, radiation, or surgery. The other 50% is finding out what the heck is going on. Why did your body create cancer? Right? You don't catch cancer, your body makes it.
Yeah, totally.
That's a very important thing that people need to understand. The body isn't faulty. It doesn't make mistakes, right? It's the condition of our body that creates that tumor. The tumor is our survival mechanism, right? It'll kill you. A tumor will kill you at some point because it'll grow. It's sort of an end stage survival mechanism.
Yeah.
So instead of trying to fight the tumor or fight the cancer, let's figure out what's going on. Why is the body creating that? And then taking a step back to help the body.
Totally. And I think that comes, coming back to the reason why it is such an epidemic, because, a lot of people get cancer once in their life, but even more people get cancer twice in their life or 3 times in their life. It's like, I don't know what the statistics are, but the rate of recurrence is quite high. And
It's very high.
It's always been interesting to me, because a lot of people look at a 5-year survival rate and they say, okay, you're cured of cancer. And it's like, wait, what? 5 years is, you can't.
Yeah. We're really aiming low. Yeah. We're aiming low as a society.
Exactly.
Yeah. And you get it in 5 year, one day, you're still a survivor. It's just, this is cancer again. The reason why is because after 5 years, your chances of getting cancer apparently are much lower. Although I've seen people recur. Unfortunately, I tell patients this: we have to find out what's going on, why your body created the cancer, right? Otherwise, there's fertile ground for recurrence, right? There's people who get breast surgery, chemo, go home, and then 40 years later they pass away of a heart attack or something else, and it never comes back. What great constitution these people have! But the majority of the people, when you have conventional treatment and don't do anything else, you still have fertile ground for recurrence. And I'll tell you personally, I've seen that happen. And it's a surprise, because in the position that I was in, I said, wait a minute, this person got chemotherapy. I thought we were done, right? There was no cancer on the scans. I thought it was gone. It doesn't work that way. And I think people are under this belief system that they go, oh, well, it's gone. The final scans didn't show anything. And then the 2-month scan was fine. And the 4-month scan was fine. Guess what? On the 6-month scan, all of a sudden, a new spot on the lungs. And then there you go. That's your metastatic cancer that's aggressive. That's one that will kill you.
Yeah, because that new spot on the lungs, that's a chemo resistant and kind of a more mutated strand. And
the body is smart. The body's smart. We have targeted therapies that try to target one specific pathway that cancer takes, or maybe a few specific pathways, and it's sort of like if you're going down the road and there's a detour or there's cones blocking it, cancer creates a completely new road. Instead of taking just that same road or the one next to it, it creates 10 new roads to evade that one blockage. It's very smart. It's in many ways, it's a mess, but it's a sophisticated mess. Basically,
sure.
Cancer genes and cancer.
Yeah, and
that's what we find.
Yeah. And my understanding of that sophisticated mess is it comes down to the fact that the divine intelligence, if I could use that word, I do on this podcast, that like the intelligence of the cancer is the same intelligence as our body, it's bred to survive and thrive. So I love your perspective of really understanding why the body is making cancer, or why the body is, promoting an environment that allows cancer to be, thriving and growing. So
I understand the medical paradigm approach to cancer, saying we have to beat cancer and fight cancer and walks against cancer and anti-cancer. But instead of going like, why was I blessed with a tumor? Because had you not been blessed with a tumor, you would have been dead before the tumor even grew. That's what I say. So the body is smart. Listen, the body's smart enough to create a cyst. The body's smart enough to create a lipoma, a fatty growth, right? If they're of the same idea of what the body's doing, then the body's smart enough to create a tumor also.
Yeah, no, I'd love to kind of chill out here and slow down and talk about this idea of the body's, innate intelligence of creating a cancer as a protective mechanism. Could you kind of like walk us through how that might be in our world today?
Yeah. So I do believe, and I've seen personally, the body, if we think about, if someone presents to me with a cyst, right? Or a history of cysts, right? sure, genetically they're creating cysts, but what is the body doing by creating cysts? Well, what we see is that there's the body siphoning toxins in the blood in order to increase and enhance the patient's, the organism's survival, right? What I've seen personally with cancer is that strong detoxes, real strong detoxes, especially when their blood levels are through the roof with different heavy metals and formaldehyde, say benzenes, dioxins. When we move that, and if it's it's overly aggressive, the tumor gets bigger, right? So the tumor sort of responds with the level of detox, which is kind of crazy, right?
So my understanding based on what you're saying is that as we're detoxing, what that means is some of these chemicals are coming out of our blood and into the blood from the tissue and then getting reabsorbed into different, kind of deposits throughout the body.
If their routes of detoxification and elimination are blocked, then what happens is the tumor cell just sucks it up, right? It holds it in, right? And there's instances where tumor cells have been opened and they've found chemicals in there. Chemicals, which is, you got to understand, what is the body doing by creating the tumor, right?
Yeah.
So is then not the body creating this issue, right? This thing we call a tumor. Is then not the body creating it to protect its own survival by siphoning these toxins, right? By holding in all these toxins. I've seen it with a patient going through a detox. Their tumor got bigger with the detox. Their tumor stopped growth when the detox stopped. And then the tumor got smaller when the detox was more gently grown. Gently undertaken, and their routes of elimination were opened up. So they were going to the bathroom once or twice a day. They were sweating every day. Their liver functioning was optimal, right? That type of stuff.
Yeah, no, it makes perfect, complete sense. And I love when I learn new things and hear new things. I often have like an experience in my body. I'm like, yeah, like, of course, duh, like that's it.
Yeah. That's your intuition talking to you, man.
Exactly. And I know it's it. I know what you're talking about is the truth. And it's just so surprising to me that I can, unfortunately, it'll probably be years or a decade until we kind of recognize this on a global perspective.
Wouldn't it be crazy? And listen, I don't want to take a simplistic view. It may be way more complex in many ways, but this could be the common denominator on the basis of it, right? Wouldn't it be crazy if every conventional hospital in America, you go in and you get a workup to find out what like these sophisticated labs finding out exactly what your level is of toxins in your blood, right? And finding out which ones. And then they do professional. We have all these fancy machines and we do a professional detox and get rid of it before we even do a surgery on a tumor. Wouldn't it be incredible if something like that was around to see, all right, well, we're doing this, and going hand in hand is the regression of the size of the tumor, right? And then all of a sudden that disappeared. We didn't even have to do surgery. A lot of surgeons would be mad. But what I'm trying to say is that what if we took an approach like this? Probably never going to happen. At least in our lifetimes.
Yeah.
But that's our jobs, right? As alternative practitioners, to find out. Then if they can't do it, if they're doing their job, then let's do our job.
For sure.
Yeah. So that's what I'm saying. Like, the tumor's there for a reason. If it's impinging on a life function, then you got to get it out. You're right. You're going to die in a few days if you don't. Mm-hmm. But what if you work with the tumor? Find out what it's doing. Why is it doing it? And at least stopping and seizing its growth by going through other routes. Right.
Yeah.
It's always something that I try to entertain with many practitioners. A lot of people are very open to it because they have an understanding that, hey, we're not really working in our paradigm right now because cancer care isn't necessary.
Yeah. And I think that's really, the ultimate answer is at some point, people are just going to have this wake up. I hope, who knows when it'll be, but it's like, listen, things are not getting any better in terms of what we're doing, in terms of rates, in terms of survival. I think people are kind of realizing that, I know that the United States is always recognized as being like cutting edge in a lot of ways. And I think the, general public is kind of waking up to the fact, yeah, we're not really cutting edge. We're kind of slow in a lot of ways. And,
Yeah.
I think it's
Yeah.
just, the critical mass kind of thing. I think we're getting there in terms of the, collective wake up to it.
There's a collective wake up for health, for
Yeah.
self-advocacy, for people, just in every single way. There's a consciousness thing. People are, quote unquote, waking up to a lot of things. And, short of cancer care, there's so many other things that people are doing, which is so encouraging.
For sure. Yeah, no, it is. I'm definitely an optimist in this world of waking up. And, that's, and I know that you are too. That's why we're here.
For sure.
Yeah. So I want to talk about some more specifics with regard to toxins and cancer and treatment. And you were talking about, you don't want to detox too hard. You don't want to because that'll just shove everything back into tumors and grow more cancer cells. Yeah. So yeah, what's your kind of general approach? I know it's kind of a complicated question, but
yeah. I mean, there's so many approaches, right? So I've had full-blown, athletes who ate well all their life, who've been diagnosed with cancer. I've seen it, So I've had super healthy people present all their lives, but it's not just a diet thing, People change their diet and their cancer they do better with cancer. But to me, just changing your diet and eating more broccoli isn't going to stop cancer, right? Mm-hmm. We have to find out what our burden is. What's the other side? That's only, 50%. It's a matter of really being assessed and figuring out what our level or our exposures of particular toxins that are, this is the crazy part. There are toxins that are clear-cut cause cancer. They're grade 1 cancer causes, but we don't even test for that. Mm-hmm. But then I have a breast cancer patient, I test for it, and it's in the 90th percentile. We can't say definitively here, that's the cause of your cancer, but what I can say, that's a major cause of your cancer, mm-hmm. And then, so that's one of 170 that are tested for, right? So you can imagine how many things, especially in cancer patients, that we see. So going back to your question, it's those type of things, being assessed for that, seeing what your levels are, and then having a plan to get rid of that stuff, as far as removing yourself from the exposures, finding out what they are in your everyday, going through everything.
Yeah, that's step one, right? That's
step one.
Step zero. Yeah.
That's step zero. Yeah.
Yeah.
And I do that a lot. I go to people's homes and I'll go through their pantry and I'll go through their cabinets and I'll go through their makeup thing. And I'll go, listen, here's your choice. We're going to throw away $250 worth of whatever, or you're going to keep it and keep being exposed, and there's people who are like, no, let's do it. Because that's an everyday exposure. The cosmetics industry is one of the most sneaky industries, aside from other industries that we know about. But cosmetics industry labels they do their own safety. They label, there's no regulation over it, mm-hmm. right? Which is crazy.
Yeah.
And then they say, it's only really a little in your shampoo. It's only really a little in your moisturizer, right? But the average woman uses over 12 to 15 products in their face, in their body.
Daily.
They're exposed to it.
Yeah.
Daily. Each of them having over 20 plus chemicals. Now let's see we don't even know how they work together. We just know, alone, it's going to be a little. You'll be fine. What about additively over time and them working together, what they do?
Yeah, that's a really good point. Yeah, that's a really great point.
On the synergy.
Yeah.
Yeah.
Because
so let's think about that.
Yeah, the nature of science is reductionistic in a lot of ways, and we like to focus in, what does this chemical do? What does that chemical do? Okay, this does this, that does that, at this level, it's okay. But yeah, that's a really good point. We don't know this, chemical soup that we're all exposed to.
Yeah, the chemical soup. And then they're putting in tampons, right? Over 11,000 tampons in their lifetime. They're putting in tampons that have known chemicals that cause disease. And they're putting it in the vagina, which is super absorbent, right? Sucking it into the blood. And then doing everything else that they do. Men too, right? Maybe a little bit less, but men too. I've seen men with high levels of everything. So that's what I'm trying to say. It's like, we don't even think about this stuff because guess what? They sell it at our favorite beauty store, at the supermarket. And if it's it's on the shelf, it's got to be safe. I mean, I've encountered that more times than you can imagine. Right.
Yeah.
So we buy it, we use it every day, not thinking about what the additive effect is. This isn't even talking about like cleaning our floors when we get home, right? All those chemicals that we use in cleaning supplies, right? And then we eat really crappy food, right? And then our livers are burdened, right? We have liver, kidney, lungs, skin, bowel movements. They get rid of all this stuff, but they get rid of all this stuff. But when these things are burdened, they start backing up, and guess what? It goes into our fat tissue and it starts building up over our lifetime. And it's really these type of things that no one's addressing, and they need to be addressed, especially in cancer.
Totally. Yeah. You summed it up really beautifully for us right there. It's kind of like daunting in a lot of ways, like, oh my gosh, this and that and that and this and this and that.
Right.
And it's like, yes, we can chip away, and that's step zero. That's like the first thing. And I think you would probably agree with me that that's what we should do way before a cancer diagnosis. That's what we should do now. That's I like to think of, I'm really obsessed with one of Albert Einstein's quotes, which is the one about, issues cannot be solved from the level of consciousness from which they're created.
Yeah.
And we are looking for this cancer cure under like a microscope, magnifying glass, looking at genes.
Yeah.
And it's like, no, the level of consciousness that created cancer is the kind of industrial age, the industrialization, the chemicals. So the step zero, the cleaning up, that in my mind, and I don't know if you would agree, that's like the cure of cancer. Would you go as far to say that, or?
I think that as naturopaths, we have to be careful when we say cure, which I am very careful to say.
But in terms of like in terms of like slowing the global epidemic and like actually reducing cancer rates, that's like the cure.
I think taking that approach of having an understanding of what your personal exposures are. This is aside from even walking outside and breathing the air. We're already exposed. But what we have the power to do is make the interventions with what we are exposing ourselves to through food, through water, through cosmetics, through personal care products, cleaning supplies. All these things is every single day on some level. So do I believe there will be a reduction in cancer if all of these things were addressed? Yeah, for sure. Because I believe it's a huge chunk of cancer that's not being talked about.
Yeah.
That's why.
Yeah.
And aside from so many other things, this is a major piece of that pie, the pie graph, that is completely just overlooked. Right?
Yeah.
But then people go, just eat healthy, eat more vegetables and fruits, which I'm a huge advocate of, but sleep better, exercise, which have so much evidence behind them. But it's these things that who the heck mentions it? Even naturopathic doctors overlook it. I've seen naturopathic doctors.
Yeah. It's a huge can of worms, it's a huge can of worms, and it's really challenging.
You chip away at it. Yeah. You chip away at it. Like I've seen people go, oh my God, I have to throw away my whole apartment. Right. It's not necessarily that, but we slowly make a change. I've seen, I had a client who was a makeup artist. It took her a year to make a change on all her makeup. All her brushes ran out or whatever. I said, fine, just start making a change. Right. And in the meantime, we'll support your liver. We'll support your kidneys. Right. We'll make sure you're going to the bathroom. You're sweating every day,
Yeah. Yeah. No, that's great. I love step zero. That's where I love to focus. And, that was very comprehensive. So what's step one? If that's like, step zero, what's the next thing?
So the next thing is starting to make a change, right? Like knowing you can use the environmental working group, and they have a Skin Deep app and they have personal care products. You can totally cross-reference what you have in your home and see what level of disease-causing chemicals they have and which ones.
Yeah.
Which is it's a good resource.
Yeah, and I'd love to know a little bit more about your thoughts of the environmental working group because it has these kind of ranges once again of like what's acceptable, and
Mhm.
part of me thinks like, hey, like nothing's acceptable really,
Yeah, yeah,
but what are your
yeah.
thoughts?
I think they do a better job than I think they're doing the only one doing a job
Yeah,
on bringing awareness.
it's all we got. It's all we got really.
It's all we got. So if you have a suntan lotion and it's bicarbonate, I'm sorry, carbonate, but it's bicarbonate, then you put it up and all of a sudden there's red everywhere and it's a 4 and you go, oh my God, well, not only is it causing endocrine disruption, right? My hormones are being disrupted, which could lead to cancer down the road in itself, but it has carcinogenicity, right? And you go, okay, well, it has cancer causing compounds and it has allergic causing compounds in skin. So you look at that and you go, all right, versus something like a Badger, right? A Badger company, which is a 0 or a 1, which is pretty benign on the skin.
Hmm.
At least you know that you're within the range. On the side of the range, it is in the green, right? Green, yellow, red in the green. So
Yeah, it's
making those
progress.
changes, it's progress, right?
Yeah,
Some people don't even want to throw away their shampoo until they're finished. Fine, finish it. Look for a new one.
yeah,
You know, and I think as opposed to 5 years ago, there's so because the alternative care industry has boomed. Now we have more high end shampoos
yeah,
or conditioners that people are using because I find a lot of women are go, but this shampoo is the best for my hair, you know. Whereas now we can explore the other options, right? There's formulations out there that are much healthier.
yeah,
And
yeah.
we're just dogging on shampoo, but we're not, there's toothpaste, for example, even at that,
Sure.
you know?
Sure. Everything in the house that has ingredients on it,
Mhm.
you want to know what those ingredients are.
Yeah.
Yeah, for sure. So, okay. So cleaning up the environment, and then, chipping away at it slowly, doing our best. And then what about in terms of, you know, getting the toxins out of our body that are already in? Because I want to go back to that point you made about not doing it too fast because you'll just shove them into a
Sure.
tumor. Yeah.
You'll shove it into a tumor, right? Your routes of detox and elimination aren't open. I mean, if someone's going to the bathroom once every 3 days, right, and they're eating like crap, they're eating processed foods, getting rid of this stuff it's going to help, but your body, the next step is your body taking all of those toxins out in its own innate intelligence, knowing how to do it better than any doctor, taking those toxins out, and then you're pooping and peeing them out,
Mhm.
sweating them out. So I think the next step is working with a professional, working with someone who can help you uh, increase those, open up those routes of elimination, right? So let's get the best liver support for you. Let's clean up that diet to make sure it's helping your routes of elimination, right? Making sure your kidneys are working, making sure you're sweating, put you on a plan. That way, you're moving things by your own self, right? And then
Mhm.
your body's strong. When your body's strong enough, it's able to take that stuff out of your fat cells, bring them to your blood, conjugate them with other things, and then you poop them out. So
Mhm.
that's the next step.
Cool. So you were talking when you were talking about people detoxing too fast and creating, blowing up a tumor cell or tumor cells. Those are the people who just aren't they're they're going to the bathroom every 3 days and they're not sweating and they're kind of just sitting around. So they're going on like a strict juice fast or water
Mm-hmm.
fast or something. Is
Mm-hmm.
that what you're talking about?
Yeah,
Yeah.
I've seen. I mean, the liver is so incredibly versatile and sophisticated. It's such a beautiful organ, and through life and through exposures and all the stuff we're putting into it and all that crap, it becomes overwhelmed. It becomes backed up. It becomes burdened for sure. And if you're
Mhm.
drinking alcohol, all of a sudden it's even more burden. So I think it's a matter of taking out. It is a matter of taking out all of the things that are burdening these organs of detox, and then supporting them with all the things that do. Nature blessed us with different. We have burdock, we have dandelion, we have beets, right? We have all cruciferous vegetables, which have compounds in that help support our liver to get rid of this crap in itself, right? We're
Mhm.
blessed with this stuff. So we have to support it in that route rather than just going, all right, I've taken away all my cosmetics and all of my shampoo, and then now I'm ready to just do a juice fast.
Mhm.
It doesn't.
Yeah. So I just want to summarize. So the step 0, cleaning things up. Step 1 is opening up the routes of elimination.
Yeah.
And then step 2 is kind of like the detox, supporting detox specifically with
Real detox. Yeah.
crucifers and the
Yeah.
Bible.
Even sometimes people need a stronger detox. Some people need a gentle detox. That's where it's your own personalized route according to, if you hook up with a professional who can evaluate this, then we can put together something for you that would be necessary.
Yeah. Cool. No, I love that. And then what would be, we're talking about like someone who's looking for an alternative cancer treatment. So what's next? It sounds like those are the foundational things. And then are you a fan of other sort of interventions, whether it's,
So taking these routes, and then with the informed consent that you have, making a decision based on, I believe in people's rights, but through informed consent. They have to know what they're getting into.
For sure.
So, so if they go, you know what, let's go, I'm ready to do chemo, radiation, or whatever, surgery, then supporting that, right? Making sure they're going through that the strongest they've ever been. Right? So they're glowing like that person in the elevator, the person that you saw.
Yeah.
And then helping guide them to other routes, even if they decide to go somewhere else or another route. And there are other routes, even in this country. There's clinics in Mexico that I don't know how, I can't speak on them because I don't know how well they work. Been down to Mexico. I've seen one of them. I was only there for a day. I haven't seen how well they work. A lot of people go down to Mexico, but I don't think they're practicing a lot of evidence-based medicine. So it's hard to say, they may be doing the best job in the world. They may be doing the worst job in the world. That's why. But there's people in this country who are licensed and doing variations on many things and they tend to do better with different cancers than most conventional.
Yeah. So I know it's a whole kind of other topic and conversation, but out of the alternative interventions, whether it's, intravenous stuff and other things like that, what can you say, or what are your kind of beliefs on a lot of these interventions? Or
so like does IV vitamin C cure cancer, or something like that? I think it supports people's well-being and strength during chemotherapy or radiation, but
yeah, they've got to have that foundation in place for sure that we talked about. And then
right. Yeah. But I don't think that you can just go and do IV vitamin C and go, I'm going to cure cancer with this. So I think it needs to be more comprehensive. It needs to be more comprehensive with a team of whatever doctors that you choose that are doing the best of their own work, right? For example, there's doctors out there doing even low dose chemotherapy, right? Which people tend to do much better than, but tend to do much better as far as side effect wise. But also efficacy, a lot of people tend to do well too, especially in different clinics that do it. They just do different approaches, which, tend to work with the body more than, throwing a jackhammer or an atomic bomb in a rainforest.
Yeah. Cool. Are you familiar with the book Radical Remission?
Yeah, it's right back there on my bookshelf.
Love that book. Curious to know, it was kind of blew me away because, especially when considering, all these cases of radical remission, the fact that there's only really 2 of the kind of 9 topics that are kind of physically oriented, like we're talking about. It's amazing that there's this whole other dimension of the psycho, spiritual, emotional.
Hell yeah, for sure.
And how can, what are your recommendations for patients to support their psycho, spiritual, emotional health through this process?
We are only talking about physical. I mean, I can guarantee that every cancer has some sort of mental, emotional, spiritual component to it. Always. What the blessing of cancer is aside from keeping you alive by creating a tumor, it also forces many, many people to a crossroads in their life, right? To reassess who they are, what they are in relation to other people. right?
Yeah.
So I think that cancer gives you an excellent opportunity to let go of things that have been growing inside of you.
Yeah.
For
Yeah.
even in many ways, that's a really telling statement right there, growing inside of you. But yeah, letting go of all those things. There is an emotional component to cancer that I guarantee. Even if you're mentally stressed, we can explain the mechanism, right?
Sure. That's physiology. That's physiology, really.
Yeah,
It's
but
like,
that's the mental thing. But when
yeah.
I do believe there's that emotional holding on, the emotional suppression, the not letting go, the not forgiving yourself and others. So there's a deeply spiritual thing. There was I think it was the CEO of Garden of Life was diagnosed with a cancer, I think, and he like went up to a mountain. I hope I'm talking about the right person, but he went up to a mountain and he took a notebook and he just wrote every stage of his life and things that he needed to forgive and love and send love to. And he didn't go the traditional route, from my understanding. And he's been cancer free,
Mhm.
Now, I'm not saying everyone's quote unquote cure is very different, but everyone's life experience is very different too, right?
For sure. For
So
sure.
what can we do? Go be in meditation, right? Be alone, or you don't even have to be in meditation. Just write. Just figure your shit out, because
Mhm.
until the point where it boils over and starts filling outside of the cup and then manifesting as a big disease that you have, a chronic disease.
Yeah. Yeah. I love it. From my interpretation of what you're saying, it really comes down to listening to that tumor, listening to what that tumor is pushing you towards, guiding you towards, you
Mm-hmm.
know, and I love the metaphor of, we're holding on to stuff in the body and it manifests physically. Also curious to know, it's been brought to my awareness a little bit more recently, this idea of a cancer personality, like a cancer. Are you familiar with that concept? It's like the
No,
personality type of of someone with cancer.
no, but I've seen different. I've seen loosely, right? Loosely.
Yeah.
Just look. Like I am scientific. I'll read my evidence-based stuff. I'll highlight. I'll circle. I'll look at graphs, and then the other side of me will go on a hill for half a day and just meditate. So what I'm trying to say is that within that realm, yes, I've observed um, different personality types. I do see some commonalities in particular cancers rather than cancer as a whole. Let's say,
Mm-hmm.
for example, pancreatic cancer. People tend to be, what I see is a lot of people with pancreatic cancer, at least physically, are very fit usually, and are, how do I say, kind of like type A. We'll say that's for lack of better terms, type A, right? Um, I do notice that a lot. So when you see a lot of these patients, you see sort of like a common string. It's a loose string, but yeah,
Mm-hmm.
I don't know. Maybe that's what you're alluding to for the cancer personality type.
Yeah.
I mean,
Yeah.
if any personality that you're predisposed to cancer is going to be type A, right? Your sympathetic nervous system is always acting, going and going and going. That's causing the whole cortisol. But maybe there's a thing to it. I think it's more just looking at yourself and being like, what's my mess that I'm holding in, and let's start cleaning that up. Doesn't matter if you're 20, doesn't matter if you're 30 or 50, 60, 80.
Yeah, totally. Totally. Yeah, that's kind of, I was just kind of wondering based on your experience and observing personalities, because yeah, it does make sense exactly like what you were talking about, that there's these loose strands that kind of thread through,
Yeah.
and it's definitely not, shouldn't be any sort of diagnostic or
Yeah.
predictive thing, but
Yeah.
it's interesting.
Yeah.
Yeah. How about, I kind of like to ask this question to some people. I'm curious to know your thoughts on, in general, I know it's like a huge topic once again, but supplementation for the general public. Like, do you believe that humans as a general need supplements to support, whether it's support their normal detoxification, support the nutrients that are depleted from the soil?
Mm-hmm.
Like, or
Yeah,
do
I
you
do.
think we can, yeah,
I do. I
yeah,
do. In this day and age, we do.
yeah.
Right? Because there's studies out there that show that there's a major depletion in minerals in our soil, different vitamins in our food, right? So that's an issue,
Hmm.
okay? And there's certain um, supplements that we should all be taking. You know, at least a good quality multivitamin. You know, let's just start with that, a good
Yeah.
quality one. And when I say good quality, is a major range between them.
Yeah, regardless, and from my understanding of what you're saying, regardless of the, how amazing your diet is.
Yeah, at least
Yeah.
supporting it with you know, I listen. I've been vegan for four years, and I've been vegetarian for like 12. You know,
Hmm.
and um, unfortunately, we've ruined our soil so much that we got rid of the bacteria that creates B12.
Sure.
Right?
Yeah.
So we're going to have to supplement that, but that's just one, right? We're so depleted in selenium in our soil, magnesium in our soil. So can we at least have a mineral complex or a multivitamin? That's really important. This isn't even talking about family histories, right? If you have a family history of your mom had breast cancer, your dad had another cancer, then let's make sure you're getting some anti-cancer stuff, or
Yeah.
stuff that prevents cancer, stuff that detoxes you, right? Stuff that increases your vitality.
Yeah. Yeah. And from my understanding as well, given the toxic nature of our world today, our
Yeah,
detox pathways are just always going, and they're
always
just
going.
running out of, the nutrients that fuel all these pathways.
We're all mentally stressed on some level too, right? So are we supporting adrenals, right? How many people come to you with general symptoms going, I don't know, I'm just tired and I don't sleep well, and I just have no motivation, right? It's like
Hmm.
how well is their whole hormone system working? So yes, people need supplements. People need good quality supplements. Don't go to GNC. Don't go to Walgreens. Don't go to Target. You know, many times don't go to Amazon because there's a lot of counterfeit crap on there too.
Yeah, that's a good point.
Yeah, consult with people who know how to lead you with how to get the right stuff for your body.
Totally. Well, gosh, we kind of like swept over so much in the last hour, I
Yeah,
guess.
yeah, yeah, like a
Yeah.
tornado.
No, I loved it. I feel like we did kind of, graze very nicely over so many topics. Any other thoughts that came up in this conversation for
Yeah,
you? Yeah.
I think the importance of staying away from plastics, phthalates and BPA they can't be understated. Men and women, they are closely linked to breast cancers, uterine cancers, thyroid cancers, even prostate. So we need to stay away from these things, uh, and we're exposing ourselves to water every day,
Hmm.
right? So where are you getting your water? Do you have a water filter that is purifying your water, getting rid of things like fluoride, right? Chlorine, antibiotics, medicines in the water. So, well, I mean, look, like I drink 2 of these a day. I want to be damn sure that I'm getting good quality water, you know.
Yeah.
So that's what I'm trying to say. Like, stay away from those plastic bottles. Look, if they're heated, even worse. But still, they're already leaching these chemicals that affect our hormones. So I
Yeah.
always want to just let people know that here, hey, you have an option. Like, go get a stainless steel water bottle, or even a glass one, and get a water pitcher like a Berkey. You know.
Hmm. Yeah. No, that's a great, when it comes to the whole world of environmental medicine, I feel like I love thinking of it as step zero, because
Yeah.
it's really anyone's personal responsibility. It's not something that the doctor can, or anyone
No.
for that matter, can do for you.
Yeah. Yeah.
So
Short of you coming in and cleaning out your closet and pantry,
yeah, it sounds
I'm
like
not going to do
that's
it every week. Like, you gotta do it yourself.
yeah. So it sounds like that is something that you do in your practice. Sometimes you go to
Yeah.
people's homes, and that's pretty
Yeah. Yeah.
awesome.
Yeah. Yeah.
Yeah,
Yeah.
tell us a little bit more about
I
that
yeah.
aspect of your
People
practice.
people will drive. I'll drive up to them. I did partially. I did some of that in London. The family flew me out to do something like that, which is so cool. But then on top of that, we'll go food shopping together. And
Hmm.
I'll be like, this is how you read this. This is what this number means. This is what these nutrition facts mean. This is what you want to look for. And I'm shocked to see how many people have no idea. No one ever taught them, and that's
Hmm.
important. So yeah, I'll go in. I'll come in like a tornado, but like a really gentle, educated one, and flip over their house. Yeah. And I've always had that. I had that vision of that in med school. So it's nice for that came to fruition.
That's awesome. Yeah. No, I love that. I love that. Cool. So where can people learn a little bit more about Dr. G, Dr.
Yeah.
Christian
Oh, yeah.
Gonzalez?
So I have anyone can always go on Instagram if you have Instagram. It's at it's at underscore Dr.G underscore. Couldn't
It's a
name
little
it.
confusing, but
I
once you
know.
got him, then
Yeah.
he's
Yeah.
there.
Yeah. Once you got me, I'll be there. The website, I've been working on a website, but I've also been working on another website. So that website will be up soon enough. I'm sort of on Facebook. I don't really like Facebook that much. And then anyone can email me at info@DocGonzalez.com. I will be launching my food medicine business this week. So we are creating doctor formulated food medicine meals for individuals. It's individualized. So, and that's for delivery and just meal plans. So that's coming in this week, which is the website. That's why the website, I was like focused on that. So
cool. So is that meal plan service just in Los Angeles, or?
It's a meal plan's available to anywhere in the world.
Okay.
Delivery would be Los Angeles, immediate Los Angeles area until, we increase our logistics and capacity, and then we could just go deliver everywhere in Los Angeles and then send out boxes to people everywhere else.
Cool. That sounds awesome.
Yeah. Listen, if people want convenience, why not give them food that is made for them, right? If we can send out detox fruits and vegetables, and like super tasty chef made meals, come on, like, and you have to cook them right, and we give you directions on how to cook, like, come on.
So is it like a Blue Apron kind of, you
Better.
get everything, but that kind of of course it's better. I know it's better,
Yeah.
but like that kind of concept, you get kind of a meal, like an instructions on how to prepare.
Instructions on how to prepare. Now, as far as the logistics of Blue Apron, we're not delivering the raw food yet, or we're not delivering prepared meals yet. Yeah,
okay.
we have to get it going a little bit, but we are being able to deliver meals to people locally in the LA area, which is really cool. But outside of the LA area, you're going to get a meal plan, but it's your responsibility to go to the supermarket and get it together and make it. But that's only short term. Long term, it'll be a lot more.
Love
cool
it.
Stuff, right? Yeah,
totally cool stuff. Love it. Didn't realize that's what you're up to. That's sounds
what I'm
awesome.
doing in the wings,
Cool. All right. Well, Dr. G, thank you for your time, my friend.
It's a pleasure.
It's been a lot of fun, and thanks for enlightening us to. I love the focus on step 0, cleaning out the life. Step 0, first and foremost, before anything. So thanks again for your time, and we'll be in touch. Cool.
Okay, brother. I'll see you.
All right. Peace and love.
Peace and love.